affected by crisis, to accelerate innovation and new ways of working in crisis response, and to generate and promote uptake of evidence and learning. Whilst I'm delighted to welcome you all here today, I also join with a heavy heart. One of our panellists, Ihab, who's based in Gaza, is unable to join us because of the ongoing situation there. Ihab is a member of our expert advisory group, which is comprised of individuals who bring expertise derived from both lived experience of crisis and displacement, as well as professional experience and expertise in early childhood development. We will be scheduling a future edition of the Nurturing Futures webinar dedicated to Gaza, and we hope that Ihab will be able to join us then. Our thoughts are obviously with him. I'm going to hand over now to Dr. Joan Lombardi, who I'm sure is known to many of you for her global leadership on early childhood development. I'm delighted to say that Joan is the co-chair of our research forum. So Joan, over to you.
Thank you so much, Tricia. Thank you and welcome everyone. It is so important that we're gathered here today. We know that the number of children living in conflict zones has doubled since 1990, and in 2024, last year, was one of the worst years in history for children. So it's totally appropriate that we're doing this session today and learning and joining together. On behalf of my co-chair for the MMA Research Forum, Erin Merriam, I welcome you to what is the first of this series. The goals of this webinar series are to promote awareness, to facilitate knowledge sharing. We want to use this platform to really learn from each other, to enhance policy development, and we know this is a neglected area, and to advance localization. The Nurturing Futures series is a bi-monthly webinar that brings together a diverse group of voices to reflect and to develop action-oriented strategies. The upcoming series will continue. You see the dates on the screen: June 19th, August 21st, October 16th, and December 18th. So please mark your calendars for those additional webinars. To collaborate on subsequent episodes, please contact Lola at the MMA Communications Management. And we would be really interested in hearing from you and your ideas for future webinars. So if we could move to the agenda, I'm really excited that we're going to hear first from Dr. Catherine Draper about the next 1,000 days, the new Lancet that was just launched, and the implications for our work. We'll then move to a panel discussion with 3 panelists from hotspots around the world, from the Ukraine, from Sudan, and from Bangladesh. And again, as Tricia mentioned, we'll come back at another webinar to the situation in Gaza. We'll then have a moderated Q&A. We're going to leave the Q&A till after all of our speakers. And then before that interactive Q&A, we will also hear from Divya from UNICEF. After Tricia's moderating a Q&A, we'll hear a closing set of remarks from Leanna Gent. So with that, let me turn it first over to Dr. Catherine Draper, who's the co-author of the Lancet Next 1,000 Days series and an associate professor at VIT University in South Africa. Catherine, thank you so much for taking the time to share with us today. Over to you.
Thanks, Joan, and thanks very much to the Moving Minds Alliance for the invitation to speak. So if we can start with the first slide. So for many of you, the next 1,000 days might be new terminology, and it refers to the age of 2 to 5 years. We realize it's less chronologically precise than the first 1,000 days, but just like the first 1,000 days as a term did an excellent job of highlighting this critical stage of the life course, we hope that the next 1,000 days will also draw attention to this crucial phase of a child's life. Next slide, please. So why do the next 1,000 days matter? This period is a critical window for the significant growth of a range of skills. It's an opportunity to mitigate environmental risks, promote protective factors, and establish healthy developmental and behavioral trajectories. And it's a chance to sustain and build on gains in the first 1,000 days and recalibrate trajectories where opportunities were lost in the previous 1,000 days. So importantly, the nurturing care framework still applies in the next 1,000 days, and we've used this as a framework to understand what children need to thrive in this age group. And this diagram that we included in our Lancet paper maps out the key developmental outcomes in the first 1,000 days in the gray circle in the middle, how the components of nurturing care apply in this age group from a program perspective, and that's in the colored sections around the gray circle. And then lastly, the supportive policies that provide an enabling environment for development in the next 1,000 days. And that's the circle around the edge. Next, please. So it's not difficult to see how all of these layers are under threat in crisis settings. For example, we can see how the social emotional development of a child in the next 1,000 days is negatively impacted in a crisis setting. The child's caregivers would be experiencing challenges with their own mental health. They would not necessarily be receiving the support that they need, and their family would be in chaos, making it incredibly hard for them to be responsive in their caregiving. And a child in this situation would have limited opportunities to play safely with their friends or attend an early learning program, and the state of their physical health and nutrition would likely be compromised. So as part of the series, a set of reviews was conducted on the various environments that shape children's development in the next 1,000 days. Next, please. So from a quick glance, again, at the takeaways of these reviews, we can see how the environments that shape young children's development are under threat in crisis settings. So firstly, investments in parenting in the first and the next 1,000 days would be compromised. The access to quality of early learning opportunities, both inside and outside the home, would be compromised. Multi-sector actions, which we call for in this age group, may be unrealistic in crisis settings. And the risks for children with disabilities and those already suffering the impacts of climate change and pollution would be amplified. Next slide. So the series also included new evidence that highlighted the challenges to the provision of nurturing care in low and middle income countries and the impact that this makes. So this evidence showed that only 1 in 4 children aged 3 to 4 years receive adequate nurturing care in low middle income countries, and that children who have received early learning support and responsive care are approximately 2 years ahead in their development. Furthermore, we highlighted the dominance of high-income Western countries when it comes to interventions promoting early childhood development in the next 1,000 days. And all these, the structural barriers hindering the provision of nurturing care in low-middle income countries are exacerbated by crises, and both the implementation and evaluation of the interventions become less likely. Lastly, our series provided evidence on the cost of not investing in the next 1,000 days and highlighted that the benefits far outweigh the costs, specifically providing 1 year of early childhood care and education to all children costs on average less than 1% of GDP. And the benefits of providing this 1 year of early childhood care and education to all children are on average 8 to 19 times larger than the cost of implementing these in low and middle income countries. However, crises threaten government investments when there are so many competing priorities, and the provision of quality early childhood care and education services is also threatened. So in conclusion, the next slide. Development in the next 1,000 days is multidimensional, it's cumulative and continuous, and we need more evidence from low middle income countries. But importantly, we cannot leave our children in crisis settings who are the most vulnerable. And just to point out that we are not advocating for a deficit model of early childhood development or blaming caregivers for not providing nurturing care in any setting, whether it's a low middle income country or crisis setting or both. Rather, we want to emphasize and build on the strengths of communities, families, and children, including those in crisis settings. But taking the strengths-based approach does not mean ignoring risks and injustices. So opportunities like the discussion today help us to shine a light on these risks and injustices and build support for the children who need our help the most. I know it's been a very quick whip through our Lancet series papers, but hopefully it just really highlights the importance of considering children in crisis settings when advocating for the importance of the next 1,000 days. Thank you.
Thank you, Dr. Draper, and I know you'll be back with us during the Q&A, but I want to reinforce how important your messages are to take an asset approach, but don't deny that we're in crisis at the same time, and to balance that with the multi-sectoral needs of children in crisis. I think you gave our audience a lot that people can work on, and I hope they put these slides to good use in their own setting. So you'll be back with us in a few minutes. I want to turn to our panel now and just introduce all of them. If we could go to the next slide. Okay, so I'm delighted that we do have the three panelists with us today. We're going to have a fairly informal conversation about the different issues they're facing in their particular context, and with some response to the Lancet messages. We're going to hear from Elena Primostka, who's with the Ukraine Step-by-Step Foundation, Curie Chisholm, who's a Rohingya expert from BRAC, and then Dr. Bashir Ahmed, who's a Sudan expert and founder of Shabaka. We'll then hear some response from Divya Latta, who's the global lead in early childhood education at UNICEF. So with that, let me turn first to the situation in Ukraine. Elena, thank you so much for being with us and for all the work you've been doing during the crisis. Can you talk a little bit about what the situation is there and what strategies you've found to be most effective?
Yes, thank you for inviting me to join this very important webinar and meeting. Could I share the screen? Because I've got some, maybe it will be easier just to have something on your screen.
Sure.
So the situation in Ukraine is that in emergency, and we stay for more than 3 years, and the first instinct of the children and of everybody is to save their lives. And the first humanitarian help is to just survive with shelter, with safety, with food. But this is not enough. Survival is not enough for children and for all people. And among the young generation, they have spent their most favorite years surrounded by fear and instability. And as we know from decade of science, it is that this early experience share the brain and future in a profound, irreversible way. And it is very important to continue to advocate and prioritize ECD for more funds and more projects in Ukraine, because we can't turn over all the history, and we need to support the psychological stable situation for children, and especially invest in humanitarian basis and early childhood development, like the core pillar being mental health and psychological support. As far as children need more safe space, they need to feel emotionally safe. They need a chance to play, learn, express, and connect. But they can't do this only in case they are surrounded by like adults in stress. Sorry, adults in stress, and they must recognize emotional and toll of parents and caregivers, especially mothers and grandmothers. So the main activity and main support of project of our activity in Ukraine faced first of all adults who surrounding these people, and all our project and all our activity, most of all of our activity focused on teaching adults how to survive with this stress and how to help children, especially small children, to survive with all these problems. So this things is very important. So we need to develop all these early childhood development programs in Ukraine. And just now we are, with cooperation with ESA and with UNICEF, we are trying to implement more and more such activity in Ukraine. And for embedding MHPSS into everyday childhood life, we rebuilt shelters to classrooms and put a lot of different toys and stuff to do in these shelters. Also, we providing trainings and emotional support for teachers because they need to be stable and psychologically narrow in this situation. And the third component of our activity is offering programs for parents because they need to be more stable in this situation. And together with ESA support and partnership, we highlight and advocate ECD and needs of fundraising for the global level funds channel to USSF. Also, ESA provided us with training guides on psychological first aid, and it was adopted in context of Ukraine situation, especially in parts of shelters and all stuff. Another that we developed 10 models for parents based on ESA materials, how to support themselves, how to support children, and how to survive. And we, with cooperation with ESA, cooperation with us, we provide the study of emotional state of preschool children and effective methods of providing the psychological and pedagogical support in kindergarten. And I would like to stress that all this project, they can't be like at the moment. They should be for a long time, and not all organizations just now aware that this psychological support programs for early childhood development is very important, because this is like investment in future in case we don't have these projects. We need to invest in future more huge amounts in supporting our young and adult people in like 5-10 years, and it will be more we will need more investments and more forces to make the situation normal. So just now like paying attention to this early childhood development of all donors organization is very important for Ukraine. Thank you for your attention.
We'll come back to you. I think you're pointing out so many important points about the importance of supporting the caregiver and the resources that you've developed. We want to make sure that we share those resources across the different crises. So thank you for your work, and I'll come back to you in a moment. I want to hear next from Dr. Ahmed, who's again been working in Sudan. Dr. Ahmed.
Thank you. Thank you for this opportunity to talk about the situation in Sudan, where the conflict, as of 15th of April, has entered its third year. The humanitarian crisis, so I'll talk about it in general and then the impact in terms of the children and some of the interventions that have been taking place. So the humanitarian crisis in Sudan represents one of the largest displacement of children, and it still continues today. Sudan's population before the war was around 45 million, and the number of children who require humanitarian assistance has doubled to 15 million since 2023. This is when the fighting has erupted between Sudanese armed forces and the Rapid Support Forces. More than almost 13 million people have been displaced, and half of them are children, with nearly a third of them who are under the age of 5. On top of that, you also have famine confirmed in at least 10 locations, and there's more locations at risk with the rainy season coming up, also with funding cuts that we're seeing globally from the US, but also across from Europe and other locations as well. So all of these external also is having an impact on the internal, and the combination of it is creating a perfect storm where precarity is beyond kind of belief in terms of the current time. And I'll just say that one of the things that we kind of talk about, I do notice people talk about projects for a year or two, but conflicts impact communities generationally. So, and this is where I think this webinar really kind of I thought was so important, because we're looking at what are the opportunities for children at such a young age, what we need to provide for them to do this, because what we provide now is what's going to be the future adults that we're going to need in future to to work, to build schools, to educate, to live their lives really. So we need to really match these kind of commitments with the scale as well. And even in acute crises, one of the things is the context of Sudan, and everyone is probably focused on humanitarian assistance, and rightly so. Yes, there's famine there. There is serious violations taking place there. But we also need to look at durable solutions and resilience. So we should not just be focusing on just food aid, but also schooling, protection, all of these opportunities. This is particularly for when you have about 90% of the population of 90% of children in Sudan who are out of school. So we're not just witnessing a humanitarian emergency, but also collapse of an entire generation. And this will impact obviously to life chances for them. One thing I also wanted to kind of bring to the table is we need to think locally. One of the things is we sometimes go into this mode of we want to rescue, want to help. But in the context of Sudan specifically, most of the support and the humanitarian response has been by the communities affected by the crises themselves. So by mutual aid groups, for example, the emergency response rooms, they have been the main frontline responders for various reasons. The lack of access for international organizations and the UN, making it very difficult to access, even almost to, I think the UN, the first convoy to aid convoy to the capital only took place last December, and the conflict started in April 2023. So that tells you about the difficulty of that. So how can we work with communities, have their agencies rather than coming as rescuers on that? I would love to kind of just give more time for a discussion. So I'll just say in terms of kind of key calls to action, which is the situation in Sudan is being compounded just by the surge of grave violation against children. this including killing, maiming, abduction, sexual violence. There was a UNICEF report a couple of weeks ago which highlighted the sexual violence against children is just off the charts, really. A lot of these violations in the past, Sudan has had conflict for a long time, whereas to specific regions, but what we're seeing now is every state in the country is affected by this conflict. And we have also a small window, if you're looking at the humanitarian, is kind of responses. Rainy seasons, kind of like from June onwards, June to August, we need to kind of do interventions now. So really, we need to kind of look at the immediate, but also invest in the medium and longer term. We need to look at supporting local responders and local resilience at the community, and also just prioritize the protection of children. It's not just about survival, but for them to also thrive. I'll just leave it here. Thank you.
Thank you, and thank you for that very sobering picture. I think, when you move from Ukraine to Sudan, we're hearing similar messages, but the extent of the impact on children. I want to come back to both of you with, what can we do? What's the best advocacy strategies that you would recommend? Curie, I'm going to move on to you in the situation with the Rohingya. We sometimes move on to the next crisis and forget that we still have protracted situations that we were dealing with several years ago. So let's move on to Bangladesh. Curie.
Thank you, Joan, for this opportunity. Today, I want to draw your attention to a humanitarian crisis that continues to unfold in the Rohingya camps of Cox's Bazar. According to UN data from October 2024, 52.8% of the Rohingya population are children, many of whom face severe gaps in basic services. And tragically, the youngest among them are paying the highest price due to dwindling funding and fragmented aid. But by rethinking how we deliver support, we can turn this crisis into an opportunity for efficiency and more sustainable interventions. First, we can confront the reality. Funding cuts have forced tough choices, leaving children, especially those under 6, without adequate early childhood development services. Learning centers exist for older children at the camps, but the critical window of the first and next 1,000 days of life is slipping away for toddlers and young children. Poor health, lack of stimulation, and mental health services compound risks for their lifelong development. Meanwhile, aid sectors often work in silos. Health, nutrition, and education programs operate separately, missing chances to amplify impact. But we do not need to start from scratch, fortunately. BRAC, being the largest service provider at the camps, implemented humanitarian play labs for 0 to 5-year-old children and their parents, have reached more than 284,000 children and 300,000 parents and caregivers from the camps and host communities. From our experience, we know that by integrating services, we can do more with existing resources. For example, a learning center for 6-year-olds can also host play-based ECD intervention for younger siblings or other children. Health workers screening for malnutrition can simultaneously reach out to the mothers and fathers to provide early childhood development services. This just isn't efficiency, but it's a lifeline for children whose future depends on these early years. But integration alone isn't enough. We must also make ECD priority through relentless advocacy. That means framing ECD not as a luxury, but as urgent survival support. When we talk to parents and community, we highlight how play can heal their children and can protect their children from future adversaries. When we engage donors, we can show how ECD prevents costlier crises later. So relevance is the key. We need to meet people where they are. So I can talk about the advocacy later. Thank you.
Great, Curie, thank you. We're hearing similar messages. I think the best part of this is that we're bearing witness to this and giving visibility. These are not just numbers, they're individual children and families that are being affected, and I think that's so important. Before I turn it to Divya, I just do want to ask each of the panelists very briefly, what what would help you advocate? You heard great messages from Catherine that you can now use to put those Lancet messages into action. But if I could just go around the three of you and start with, I'll start with Dr. Ahmed.
Thank you. No, obviously, sometimes you want everything. And a lot of people talk about funding and all of this. I think there's one thing that everyone needs, which is solidarity, to know they're not doing it on their own. So if there is that kind of solidarity in messaging, sometimes we're talking about in vacuums about each crisis, but they're so interconnected as well. And there's a lot of similarities. This is why I appreciate these kind of forums, because we actually hear what's happening in all these contexts. So if we can speak about each other's context as well, I think that would be helpful. I'll just leave it here. Thank you.
That's very helpful, actually, because we do talk about these crises in a serial way rather than the damage that's happening to children and families around the world and the strengths they're bringing to it. Let me go back to the situation in Ukraine and Dr. Premoska. Anything else you would add that would help you in advocating?
Yes, I suppose in advocating, it will help in case we really share the experience or receive some experience, some good practice from our partners worldwide, because I'm 100% sure that they had one. And another point that was our supporting our country from our governments, because just now they try to implement some parts of ECD support, MHPC says support in like governance policy, but it's very, very small and slow steps. So it's very difficult to advocate this story.
Well, it's hard to
So
advocate when you're also dealing with a crisis that's continuing. But I'm hoping that some of these messages, I want to point out that the Moving Minds Alliance is a platform for the materials that all of you are developing. And we want to make sure we share that and share the research. Curie, any thoughts before I turn it to Divya for a response about what's helped you? You've been at this for a while. And you're on mute, so if I could ask you to come off, just your advice.
Yeah, so we of course know that we do need to advocate for multi-year funding, and then we need to advocate for integrated services across sectors. But rather than that, one thing we forget is we need to center Rohingya men and women in the program design. And then the solutions must come from the community and not just for it. So Rohingya parents know their children needs best, and yet they're often excluded from planning. So we need to consult with them, we need to hold participatory workshop, and we need to amplify their voices in advocacy. And donors usually listen when affected communities speak out. So I want to highlight that from my experience of working with the community.
Well, we keep hearing that, the localization, the turning to community over and over again. But at the same time, we want government to be responsive. And I think we heard that from our partner in Ukraine and from all of you. So let me turn that to Divya. UNICEF has been responding to almost all of these crises. Divya, any concluding thoughts for this panel?
Thank you. Thanks. Greetings, everyone. And thank you, Joan. What a profound conversation this has been, and such a grim reminder of the huge task ahead for which we definitely need to be in solidarity. Indeed, children don't pause development during a crisis. The brain keeps growing, and so must our support. As we have heard, prioritization of life-saving measures in emergencies typically focus on very narrowly on the nutrition, the health, the water sanitation, which are all very important, but they do neglect the healing power of early childhood care and education opportunities. As we heard from our colleagues, Olena, you talked about it, and so did Kuri and Dr. Ahmed. So these are opportunities which, if provided in safe and stimulating settings for young children, their caregivers and families can have profound impact. With limited awareness of early childhood care and education among humanitarian staff, young children remain largely invisible in humanitarian needs assessment, response plans, and indeed their communities are absent in the design, as we were just reminded. Shortage of trained ECCE facilitators, especially in underserved areas impacted by crisis, further exacerbate these gaps. This situation reflects broader under-prioritization of early childhood education in sectoral services, the funding, the data, and accountability measures. In education alone, early childhood education receives less than 2% of global humanitarian education funding. I've been listening very intently to our colleagues from the field, and they had a number of things to say, which I'm trying to pull together in my concluding remarks. Our usual advocacy approaches, of course, promote policies and programs to guide action and strengthen the accountability of duty bearers to their commitments for early childhood. So how can we use these frameworks to become live instruments in the hands of the champions and responders closer to the field to really move the needle for early childhood care and education in humanitarian action for the children, their families, and communities? So let me make 3 quick suggestions. Following from Kuri, of course, framing the services for 2 to 5-year-olds as protective, resilience building, and foundational, advocating for early childhood care and education as a core component of humanitarian responses, not a luxury. Leveraging the evidence from success stories, evaluations, brain research, and return on investment, especially as it applies to emergency situations, definitely helps us. And we need both to pull together the kinds of data and evidence that Catherine shared with us, but also further research to make this even more robust. We also need to demonstrate the demand from parents and families and further empower local actors, caregivers, and communities as ECCE champions, mobilizing youth advocates to be part of the action and promote the focus on young children in their communities is particularly noteworthy in this regard. Finally, making it easy for field staff to embrace ECCE. Whether or not you have had prior training in early childhood care and education, it is important to identify and leverage the entry points in key processes that shape the humanitarian preparedness, the response and resilience building processes. So for example, when you look at the humanitarian program cycle, what are the entry points that we can equip those people who are working on it, who are doing the needs assessment, who are developing the response plans, thereafter implementing and then reviewing them? So how can we equip them to really take into account the early childhood needs as well? Equipping field staff in humanitarian action with early childhood indicators, the priorities and intervention options through short, easy to use guidance notes and other assets would be key to this. I really have great pleasure in sharing with you that UNICEF with MMA and a few of our other partners have been working on developing some of these resources and assets, and do watch the space. We should soon be sharing these with you. I'm sure we will be back on the Nurturing Futures platform, Trisha, to really bring those out to the community and really putting it in the hands of people who will really make that difference to every child and every community in these crisis situations. Thank you so much. I'm going to close there and looking forward to your questions and discussion.
Thank you so much, Divya, and thank you for everything that UNICEF has been doing to respond to these crises, but also, I hope, to support the local actors who are on the ground every day. Before I turn it to Trisha, I have an image of a group of children that were playing in the tunnels when the bombs were falling in the early days of the Ukraine war. And I keep that picture in front of me because they really, their resilience and their responsiveness has been what I think continues to allow them to grow and for us to have hope. So Trisha, over to you. I know we have about 10 or 15 minutes for Q&A before Liana comes back to wrap us up. So over to you.
Thank you, Joan. And I can't see any questions as yet, so I'm going to take advantage of this opportunity to ask a question of my own whilst people are formulating what they'd like to engage with the panelists on. one of the things that hasn't come out so much in the conversation today, although you alluded to it, Dr. Ahmed, is are there specific issues that affect particularly vulnerable children? I'm thinking of children with disabilities, for example. I know from the war in Ukraine, Dr. Promoska, that there were significant challenges facing, children with disabilities, for example, living in institutional care and other contexts. I'm just wondering if it might be an opportunity to reflect on some of the specific challenges that we might need to advocate for especially vulnerable children. And I don't know who, maybe Dr. Promuska and Dr. Ahmed, please do come in, and Dr. Draper as well.
Okay. I'll just go ahead. No, go ahead.
Sorry, maybe. Okay, so advocating of vulnerable children was the first activity that we implemented many years ago. Started with this, with promotion and advocating this inclusive education at schools, in kindergartens, and so on. And for just now, advocating of this story is very difficult because sometimes these children are not can't stay in shelters for long, and they are under pressure of this stress and panic attacks more than other children. So we need to develop some special methods or methodologies or approaches or models for caregivers, teachers, families, like adults, how to cope with all this story. And they obviously need additional support and additional some staff to be aware where they are and for understanding the situation. And just now, another problem that a great amount of children they are not psychologically stable, so it's like invisible disability maybe become like this, and all these stresses they influence the nervous system, and we need to develop not only advocate not only like traditional approaches to cope with the situation, but something more specific, aimed or especially on them, or on some on some problems like breath activity or something like this.
Thank you so much. That's very thoughtful and insightful in relation to the specific context in Ukraine and what's happening there. But I'm wondering in Sudan and maybe even in Cox's Bazar, what are the specific issues and how do they manifest? I mean, Dr. Ahmed, some of the data that you just shared was horrific, and I just wonder to what extent children who are very vulnerable can be effectively considered and responded to, and what we need to do to advocate effectively.
I would love to kind of say there is kind of silver bullet to kind of address some of the challenges, but the conflict is still ongoing in Sudan. Protection is a major issue to date. A couple of days ago, there was an attack on it's an IDP camp in North Darfur near Al-Fashir, and children was among those who have been killed. So it's a live issue. So it's almost kind of like, how do you deal with the trauma of that? Some of the emergency response rooms have set up spaces for children just to kind of be able to play, to study, for some sort of normality. But where do you start? So you almost kind of look at a specific region. Is there active conflict? How do you protect vulnerable children? I still remember at the start of this particular war, there was an orphanage. It was quite well known. It's called Maigona, and it was one of those that people had forgot about all the children there, and they started dying. So there was a campaign. There was a fundraiser to try to get them out and their carers. So we really need to kind of also do what can we do when the situation is live in terms of protection. So it's not just about later on, how do we support? So it needs to be integrated also into the communities, because mental health, I think we have a mental health crisis. How do you deal with that? How do you provide that for children who are still alive in the midst of that trauma? It's not finished. So it's more of a broader question rather than a response that no one has perfected it or has come up with one way of doing it, respond to it. Thank you.
Yeah, I was really struck by your comment that, the impacts of conflict are generational, and sort of having that timeline rather than this sort of very project-based, time-limited approach. And Curry, as BRAC has been responding, for 6 or 7 years now, maybe there's some lessons that you can draw out in relation to the specific issues. Somebody also talked about gender in the chat. So, children who are particularly vulnerable, maybe as a consequence of gender or disability, any lessons that you can share from your work?
Yeah, sure. So what we have seen, especially working with these affected community, is that any kind of emergency, in any kind of crisis setting, gender-based violence is on rise. So that we have also seen during COVID, gender violence rise, to its peak. So when we were working with the Rohingya community, first of all, what we wanted to do is wanted to provide psychosocial help, because that was one of the reasons why most of the cases women were being victimized. And then also it was men who were committing, a lot of gender-based violence, and then aggression, a lot of anger issues, and children were not growing up in the enabling environment. So psychosocial help is absolutely key in this kind of situation. And then when we were working with mothers, initially we started working with children, and then we started working with mothers. Then we moved with the fathers, Working with the fathers and developing fathers engagement model actually helped us understand that there's a lot of traditional gender norms that lays within us that actually that can be harmful for the children and women in the family. So in order to create that harmony or balance, it is very important that we involve fathers as well. We involve fathers in the ECD, we involve parental engagement, and then it's just shouldn't only for the mothers. And also we need to ensure that with ECD services, mental health needs to be integrated.
If I may add very quickly. Every crisis is an opportunity to build back better. We've, of course, heard this millions of times. But I think what we've heard today is giving us some practical examples how this can be done. And this transformation does not only have to be building back the buildings and the structures which shape the environment of the child, but also the practices. And very quickly, in the interest of time, I'll just pick up on Kuri's example of gender transformation. I think simple ways in which we can even look at if you see typically in a preschool classroom, the books and the charts, etc., you will often see very gendered stereotypical roles. And if we can engage parents and communities to reflect on those, to start thinking about how they would do it differently if indeed these roles were not so stereotyped, and opened up the children's horizons to what other possibilities could be there. Can there be doctors who are not only men, and nurses who are also men? So men in caregiving roles, and then in using that opportunity to then engage them in the non-gender stereotypic ways that fathers and mothers engage in those programs, which will then go on to strengthen the kind of design inputs we want from communities to really make their program strong. I'm going to stop there, but just wanted to say each of these elements is a way to build back better in terms of the practices as well. And there's a whole lot of resources available. I can pass on the links to you and we can share with people.
That's fantastic. Thank you, Divya. And I can see there's a comment in the chat from Kipchichir. I apologize if I haven't said your name correctly, but I hope that some of the inputs just shared from Kuri and Divya have reflected more deeply on the importance of engaging parents and communities in program and policy design. And I just in the last couple of minutes of this Q&A, I'd like to ask a broader question. Actually, I'm going to start with you, Catherine. Sarah has written in the chat, we know the evidence is overwhelming. There's so much evidence from the brain science, other types of science that's been, the return on investment. We've got an overwhelming body of evidence. But what is really going to, shift the dial? What is really going to make policymakers, prioritize this issue? Why are the issues affecting young children in crisis not salient for a lot of policymakers? Why is this issue not prioritised? And just, your reflections as one of the co-authors of The Lancet, generating really critical pieces of evidence that we can leverage. How do we get this issue to the top of the agenda, please?
I'm not sure if I have a solid answer to all of that, but I guess part of just some of the feedback we've received is it's about kind of honing in on those really clear kind of distilled messages. And I think what seems to have really resonated is around that economic case. And I think often we are kind of preaching to the choir in these situations where everyone acknowledges that young children are really important. But I think it's the decision makers around the table where that economic case is made for certain policymakers. I hope, we've seen some movement in our own country in South Africa around that. Beyond that, I think it is the political will, and it feels like where there are certain advocates or someone that we've really connected with. I think we can't underestimate that sometimes those power of relationships and connections within governments, within policy spaces, can actually can shift the needle. And I do think as a researcher thinking about what is our role in providing the evidence that policymakers needed, I would take the opportunity to call on funders to put their money where their mouth is. And big funders, we know that international funding has been significantly decreased in the last few months, not just from the US. So we as researchers are not always getting the funding we need to do the kind of research that puts these kind of clear, powerful messages on the table for policymakers. So I think we're all in an ecosystem together, and I think there's a few things there that contribute to moving things forward.
Thank you so much. And we as the Moving Minds Alliance are investing to, develop the next generation of advocates for early childhood development, and nurturing care for children affected by crisis. And Divya, your call to action around youth advocacy, I think we've seen that these are critical pieces that we need to move forward collectively in solidarity, reflecting your thoughts, Dr. Ahmed. So I'm going to hand over now to Liana, who's going to wrap up this session. And just reminding Liana, we've got a short survey at the end. We'd love to get your impressions about this webinar and get your feedback to inform the design of future episodes. So Liana, I'm going to hand over to you. And I just want to thank our panelists for such insightful contributions today.
Thank you very much, Trisha, and thank you to all the speakers. What an inspiring session. I have a very hard task to summarize in a few minutes. What I picked up is a call to action to all of us. Advocate, advocate, advocate. We need to call on governments to prioritize the early years using arguments as were shared here, all kinds of arguments, including the economic one, but we also need to advocate with funders to prioritize child learning, development, more than just survival, protection, survival, but also how to support young children to thrive. We need to advocate with international organizations that they do not see themselves coming in as rescuers, as one of the panelists mentioned. And we need to do our best to support the local actors, their agency, their resilience. We've learned today and on many other occasions how the solutions come in a long-term process. We're not talking here about one-off projects, as one speaker said. It's really a process for the local actors to develop solutions that work to respond to the real needs of children and caregivers. What I picked up also in terms of what was shared today, the approaches, all approaches, I could see a network mindset in the approaches that were shared, not to treat the crisis individually one by one, but really to learn and share with each other as this global community that we're part of, to demonstrate the demand from parents and from advocates to empower those closest to children and caregivers. And finally, a key message came around what we can learn from the examples and good practices that were shared is to use the opportunity to rebuild. Rebuild also how we approach practices, rebuild also how we design the services. And I think we do have the evidence. We have so many examples. We now have to come together as a community. And again, I will end with the important message that was shared today. Come in solidarity, and I would add, come with this network mindset. We can only address this if we work together.
Thank you,
And,
Liana.
You see you see the survey on the screen.
Yes. And I just wanted to thank everybody for joining us today. I found this a fascinating inaugural edition of this Nurturing Futures webinar. We've had a fantastic lineup. Joan, I don't know if you wanted to wrap up with a few final words.
Yes, I just want to continue. Thanks to everyone who spoke. I think this notion that we've got to paint the picture of what's happening across countries, because that's the picture we're seeing, and bring that picture forward more. Because what's clear from this webinar is that the world is not taking this seriously enough, and that we've got to be we're the ones that are bearing witness to raise the voices and to use MMA as a platform for sharing what we're learning about how you do keep a focus on resilience in such a difficult situation. So I just want to thank everybody and urge everybody to continue to tune in to the next series of webinars that MMA will be doing to try to keep this movement going. So thanks, everyone. Very sobering. Don't give up.
Thank you, everybody.